There was a survey in October 2010, which indicated that nearly 60% of veterans did not understand or were not fully aware of the benefits available to them. And the reason that I wanted to hold this hearing is the following. I happen to think that in many areas, VA does enormously good work and enormously important work. I was just in the VA Center in White River Junction on Saturday and looked at a program there which is literally saving many lives. But no matter how good the programs are that the VA has, no matter how good the healthcare program may be, their variety of healthcare programs may be, or what they're doing in homelessness or many other areas, it doesn't mean anything to the veteran if that veteran does not know about what that program is about. Now, we have 22 million veterans in this country. Some of them do not want to access the VA, and that's fine. But I do think it's our job to do as much as we possibly can to make sure that every veteran in America has the information they need to make the choice, to understand what the VA is offering, so they can say, no, I don't want to access it, or, wow, I really didn't know that. This is terribly important to my family. I didn't know about this educational opportunity. I did not know about this health care program. So the truth is also that we are in the 21st century, and we have things like computers and emails and social media. And while I think we can say historically the VA has not done a terribly good job in outreach, I think what we can also say, in fairness to the VA, in the last few years, we have seen a significant turnaround. I can remember, and I got involved in this issue because I would say about 10 years ago in the state of Vermont, I was not impressed about how many Vermont veterans knew about VA programs. And I went around the state with VA, and we had hundreds and hundreds and hundreds of people coming out to these meetings saying, oh, I didn't know that I'm entitled to that. I didn't know what the VA has to offer in terms of low-cost prescription drugs. I didn't know how I can access that. So the bad news, I think, is historically the VA has not done a particularly good job in outreach. The good news is that I think, and we have seen some significant turnarounds. Nobody who looks at their website today will deny that that website is a heck of a lot better than it was a year ago, and that they're making progress on other fronts as well. So what we're here today is to learn from the VA how they are communicating with millions and millions of veterans, some of whom are in desperate need of VA programs but don't know about it. A particular problem is with older veterans, Korea, Vietnam, folks who do not necessarily feel comfortable on the internet. How are we reaching out to those folks? So there's a lot to discuss, and I look forward to not only to hearing from Dr. Sowers, but to hear from a wonderful panel that will follow them and to talk about the very good work they are doing independently of the VA.